Good afternoon. Welcome. I'm seeing some familiar names. Good afternoon.
Hi, everyone. If we can ask everyone to mute your phone lines or your microphones while we're having the presentation, that'd be great. We'll ask you to come off at some times.
I love seeing people with their cameras on. Good afternoon. Hi, everyone. We have people that are continuing to join us, so we're going to get started in just a few moments, but I want to give a big welcome to all of you. And I would love it if people could put their names, their pronouns, and where you work or are calling from in the chat. We would love to see who's here. And we encourage camera use and microphones on mute until we get going. Let's see. Oh, Leah, Seattle, King County. We've got Patrick from Long Beach, Valerie from San Diego, Amanda from Southern Nevada Health District, Rose, Teton County, Wyoming. Wow. Kathleen from San Francisco, Rick from Long Beach. I'm here in Oakland. Koki, Samantha from Santa Clara, Amy, Patty from Sacramento, Stephanie, Sacramento, Claudia from San Isidro. Welcome. Welcome, Shasta County, San Diego. Fantastic. So as people are continuing to come in, if you could indicate name and pronouns, please mute your phones, or I'll mute them for you. Thanks, everyone. Araceli from Tulare, Auber from Bayview. Fantastic. So I know people are going to continue to come in, and I'm going to get going, and I just want to welcome everyone. So good afternoon, and welcome to today's presentation, Housing as a Foundation of Public Health, Working with Those Who Are Unstably Housed. Many of you know me, but for those who don't, my name is Linda DeSantis. I work at the California Prevention Training Center, and I'm happy to help bring the presentation to you. The CAPTC, in collaboration with the California Department of Public Health, State Office of AIDS, and the STD Control Branch, develops and delivers presentations, trainings, and technical assistance to DIS, frontline staff, and others working in HIV, STIs, other communicable diseases throughout the state of California. Today, we're delighted to bring experts from the field to present on an important topic of housing. Many of us working in this field are presented with the challenges of our clients being unstably housed. And today we hope to better understand how housing relates to health outcomes. And with us today, we have two expert guest speakers, Jessica Heskin and Abel Martinez. Jessica is the chief of the HIV section at the State Office of AIDS. She has been at OA for almost 7 years. She started as a program advisor in the housing unit, managing the housing opportunities for persons with AIDS or HOPWA grant, and the Housing Plus program. At OA, Jessica was with, prior to working at OA, Jessica was with the Violence and Sexual Support Services Coordinator at Sacramento State University for 15 years. She created the program in 2000 and served as the educator and victim advocate provider. Additionally, she was an instructor at the Los Rios Community College System in the psychology department. Co-facilitating with her is Abel Martinez. Abel is the chief of the Care Operations Unit for the HIV Care Branch. He has been managing the Ryan White Part B program for the California Department of Health Office of AIDS since January 2019. Prior to joining the HIV Care Branch, he served in the Office of AIDS Prevention Branch, STD Control Branch, and the Office of Binational Border Health. Abel has 6 years of experience conducting disease intervention activities, providing case investigation, and mentorship on HIV, syphilis, gonorrhea, and most recently, COVID-19. He received his Master of Public Health in Health Promotion and Behavioral Science from San Diego State University. So it brings me great pleasure to have Jessica and do their magic and deliver this presentation. So Greg, if you would share your screen, and please welcome Jessica and Abel.
Thank you so much, Linda and Greg both, and everybody for coming. We really appreciate it. Abel and I have decided we'd like to start with a poll, and the poll, it's important for you to know, is completely anonymous. We're only going to see like the percentages in the answers. I'm sure all of us have by now taken those before. And the reason we wanted to start the poll with a poll is because we really kind of wanted this presentation to be, more of a discussion, but also to be able to meet the needs of the audience. And we really wanted it to be sort of an honest discussion. I'll preface this by saying the first time I worked with communities that were unstably housed, otherwise known as people who are homeless, it was called back then. It was in the sexual assault field as a victim advocate, and it was really intimidating, and it was scary. So I kind of wanted to get a pulse beat on where everybody was, and that's why we were hoping that you will be able to answer the questions and feel free to be as honest as possible. So the first question is that that's the second question, I think. Oh, maybe not.
Yes, great, yeah.
Oh, got it. So which capacity do you work in? So are you a DIS outreach worker, management of a DIS program, case manager, or other?
And Greg, if you could launch the poll.
I think I see it.
Oh, okay.
Yeah, it's launched. It's
Thank
people
you.
are interacting.
Got it.
I'll let you guys.
70% now. It says almost 80%, 82, 84, 85.
Sounds like an auction.
That's good. Here we go. Let's share the results.
Wow, there's a lot of other, huh? Okay.
Okay, ready to go on?
Yeah, so we have a lot of DIS workers. We have a much more, 58% are other. Okay, I didn't see that coming. All right, next one. Next question. So the second question is, how many years have you worked as a DIS or in a DIS-like field, I guess is the best way I can put that. It's probably not even a word that I just said, but. What's in here? Okay, 1 to 5 is winning.
%63%. We need people to be answering. We like to get 80 or more.
And if you're not directly a DIS, because I did not realize over half of you are other, then whatever field you are in, I guess, is the best way I can put that. How many years?
Yeah, we're at 79%, 80%.
Okay. Looks like most of you are in the 1 to 5 or 40% in 1 to 5, which is almost tied with less than a year. Okay. Couple veterans, 9%, good.
Okay, ready for number 3?
Yeah. is a little more sensitive one. What is your comfort level working with unstably housed individuals? And I'm going to do some terminology in a couple slides, so don't stress it. Oh, most of you are pretty comfortable. That's fantastic.
Okay, we're 88%. Looks like it stopped. 90 where? There we go.
Almost.
Here's the results.
9% of you are pretty comfortable. All right, that's good.
Okay, number 4 coming in 1 second. This is a little longer. You might take a minute to read this.
Yeah,
one.
so I'll read it, but I mean, feel free to go ahead because you're probably going to read faster than I can talk. What is the biggest concern working with unstably housed people? One, that they are non-compliant with treatment plans or whatever your focus is if you're not a DIS person. I try to find them housing and they don't follow through. I see them in the same encampment next time and I have to look for them. Number 3, they are time consuming. Number 4, I'm not sure how to relate to them or how to establish connection on a personal level in order to get them to care, if you are indeed in a linking to care capacity. I don't understand them and their lifestyle. Why don't they just get housed through public housing? I can't solve their complex issues in the short time I am seeing them. Or number 7, I have no concerns whatsoever working with unstably housed people.
We have 100%, it looks like.
Okay, why is it I can't see the poll? Oh, there we go. Great. I'm just looking at it. I can't solve their complex issues is 40%. That is usually what I would think we would see. And the non-compliance issue. Yeah, that makes sense to me. All right. Well, that is good information. I can't solve their issues in the short time is a big one, huh? Yeah. All right, well, thank you. So as we go on, I didn't have this in the slides, so I hope this isn't too big of a curveball, but I did not expect to have about half of you be other than DIS or working in the DIS field. So if you're comfortable and if you're okay, this is just for Jessica's own curiosity, if you wanted to throw in the chat like what your duty is, what your job is, I'm just curious because I didn't see that many people coming in under that. So yeah, if you could, it'd just be nice to know. So I am going to do a little bit of terminology here. So oh, go
Jessica,
ahead.
I'm just going to let you know there's a program manager from Child Death Review Program, Sexual Health Coordinator, Peer Navigation, Healthy and Resilient Housing Associate, Communicable Disease Public Health Nurse. So it looks like a wide range of assistant site manager, behavioral health clinician, community health navigator, reproductive health educator, phlebotomist, test counselor.
Wow.
A wide range of occupations here. Thank you.
Oh, good. No, health education specialist for STD programs. Oh, good, good, good. Well, thank you very much. And there is another caveat I'm going to put in here because, again, I didn't take this into consideration. I did notice that a couple people are from out of state. I noticed Las Vegas and Wyoming. I apologize. The presentation in terms of data, et cetera, are very California focused. My assumption was that most people would be from California. So just as you see the very little data, don't worry, I'm not going to bore you with a lot of data. Just know that it's within the context of the state. So good. As we go along, if you have questions and if this is agreeable to Linda and Greg, if you want to put them in the chat, that's totally acceptable. They can stop me or Abel and we can answer them. But we will also have time at the end, because I'm really wanting to make sure that we sort of hit and address the things that are really important to all of you. And so I will continue with the slide on homelessness versus unstably housed. So in the presentation, you're going to see us use two different terms. Unstably housed is the preferred sort of cultural appropriate term. And this is because when we used to say homeless, it connotates exactly what that is, that you don't have a home. And there are unstably housed people, obviously, who have, who considered where they live, whether it's in a tent or it's along the river. Here in Sacramento, we get a lot of along the river, so you'll hear that reference a lot. Or in a shelter or whatever, they consider that their home. And so it's really kind of disempowering to take that away. It's not a home that you or I might recognize as a home, but it to them is. Having said that, government and research definitions usually do differentiate between the term homeless and unstably housed. And so, which I'll go into in the next slide. And so if we can go to the next slide. Thank you. So the definitions are pretty distinct. Let's see here. Most of research in government databases, as I mentioned, do make a distinction. And so homeless by a government definition, or a lot of the research definitions, are people who are living in a place not meant for human habitation. That could be a cardboard box, that could be a park bench, that could be, a tent, a car. They could be living in an emergency shelter, in a transitional housing shelter, or they're exiting an institution where they temporarily resided. That could be some sort of health facility. That could be some sort of justice-involved facility, et cetera. And that is when you see homeless in a lot of what the Housing and Urban Development, or HUD, who is our federal agency that sort of looks at housing, you're going to see a lot of the term homeless. And in a lot of the research, especially some of the research done with unstably housed in HIV early on, homeless was what they were referring to in the literal sense, the government definition sense that you're seeing up there. Unstably housed by government definition are people who are living in temporary situations where they could become homeless at any time, like they're couch surfing, or they just lost their job and they can't afford to pay their rent, or their rent was jacked up, and so they used to be able to afford the $800 a month and now it's at $1,200 and they can't afford it. So they could be, and there's other situations too, I'm just giving some examples. So it could be that they are in a house with 4 walls or whatever, or an apartment, but at any given time they could become homeless very quickly. So those are sort of the difference. For our purposes, I usually use the term unstably housed unless I am quoting from either direct research, because I don't want to change what the researcher said. If they said homeless, I'll say homeless. Or if we're referencing something that is specific to government regulation. So does that kind of make sense? I'm hoping. Okay. Next slide, please. So most of us already know this, but I'll go over it very, very quickly. If you work with HIV or anywhere in healthcare, really, housing really is the key to healthcare. And if you think of healthcare as the house, housing is sort of the foundation to that house. Because if you are not housed, that really becomes one of your top priorities. Where are you going to shower? Where are you going to go to the bathroom? Where are you going to keep your stuff? Where are you going to keep your stuff that it's not going to be taken from you? Sometimes you don't have a refrigerator or anything. Where are you going to keep your medications, et cetera, really becomes where you're going to sleep that's safe. These become something that are of utmost priority, right? So what we know is that when people are, unstably housed, it directly affects their health on many different levels, right? They're probably not eating properly. There are issues with inclement weather. There's also, if it's in a communal situation, there can be different types of viruses that are passed, et cetera. But we do actually have some research directly related to HIV that was done early on, and I do have the references at the end of this presentation if you wanted to look them up. But Ayala is one of the premier researchers in linking stable housing to retention and care and viral load suppression, and that there is a definite link between the two, and it would make sense because it's very difficult to stay on medication if you don't have a safe place to keep your medication, right? It's very difficult to see your doctor if you are moving from place to place every night, et cetera. The link to housing has also been shown to have a positive impact on a lot of different health outcomes. Excuse me, I said incomes, it should be outcomes. For homeless people living with HIV and AIDS, because sometimes people who are living with HIV and AIDS, and normally I just say people living with HIV, but the next one, they had specifically talking about AIDS, so I threw that in there. Because a lot of times people living with HIV have comorbidities, right? So they may have TB, they may have Hep C, they may have diabetes, they may have mental health issues, they may have a lot of different things going on. And the link to housing has been able to be shown to increase positive health outcomes. Formerly homeless people living with HIV and AIDS, and in this case it was particularly AIDS diagnosis, had a lower risk of death once housed. So there was a study done where they looked at people who were homeless and their death rates, and then they looked at people who were homeless and then housed and their death rates. Does that kind of make sense? And they found that once that they were housed, that their death rates did decrease. So clearly housing is definitely a health issue, and it's something that people who have been working in housing for a long time, it used to be that housing was like a separate animal, if you will, from healthcare. They were considered unrelated. And some did I stop? Oh, okay, I'm good. Sorry. And so it's very interesting because even 7 years ago when I first started coming into housing, it was a lot of times HUD and HRSA, the two federal agencies, one over healthcare, one over housing, really didn't speak to each other. They were very siloed. And California is somewhat of an anomaly when it comes to housing and HIV, because what I didn't know until a couple years ago, clearly before COVID hit, at a HOPWA conference, and I was talking to other states, California is one of the few states where the HOPWA program, which is Housing Opportunities for Persons with AIDS, it's a housing program for people with HIV, where the HOPWA program was run in the same office as the HIV program. In all the other states I talked to, the HOPWA program was seated with the housing authorities. And they really didn't have any interaction with like their Ryan White and that type of thing. It was very interesting. And in California, we have a law that says if it has something to do with HIV, basically it has to be run out of the California Office of AIDS, and so that's how we acquired that program. But it is not that way throughout the state. Okay, next piece.
Excuse me, if people could mute their phones, please, that would be really helpful for the recording and the presenter. Thank you.
Okay. So what is the scope of the housing crisis in California? I don't think those of us who live in California, I don't think this is going to really surprise anybody. California by far faces the most monumental challenge in housing crisis in this country. Over almost half of the people who are experiencing homelessness in the United States reside in California. And to give you a proportionate amount, that 47% is about 4 times as high as the state share overall population of the United States. And in regard to people living with HIV, which has only recently sort of been able to be tracked very well, I do know that according to our medical monitoring project, about 12% of people living with HIV in California are considered homeless. Next slide, please. Sorry. So one of the questions is why? What's wrong with California? We have gorgeous weather. We have wonderful beaches. So why are we having this homeless issue? Well, for a variety of reasons. One of the things is, and I don't want to get into it too much because it's actually a very complex issue. One of the things is we have a very small amount of what would be considered affordable housing. So a lot of people that normally, and I'm trying to think of how to phrase this to kind of make it macro level, a lot of people who would be considered perhaps in other states as middle income are paying a higher percent of their salaries towards rent or mortgage than they would if they were in another state. So let's say I lived in Arkansas, and I'm making this next set of numbers up because I don't know their numbers off the top of my head, but I have been to Arkansas, and they have amazing catfish there. In Arkansas, if I made $80,000 a year, I might be paying about $20,000 or $30,000 a year, let's say, on rent. But if I make $80,000 a year and I live in California, because the cost of rent and mortgage, meaning housing prices, is so high, I am now paying 60% of my income to rent. And so that's part of the issue, right? Because families and individuals don't have a whole lot of cushion if something happens to that income or to those housing prices. So what you're seeing in front of you is that about 21% of renter households that are in California are extremely low income, and that the maximum income for a four-person, extremely low-income household at the state level, so this would be someone who would be able to apply for what's commonly known as Section 8 housing choice vouchers, rental assistance, et cetera. Family of four would make $27,330, and the shortage of rental homes that are affordable and available to those people who are making $27,000 a year, we are 962,667 homes that we don't have for people in that level. Annual household income needed to afford a two-bedroom rental home, and please understand that for HUD goes by something called fair market rent, and it is, each county has its own different calculation, which makes sense, right? Because like, you know, I don't know, Humboldt is going to have a very different rental structure than Los Angeles. So what they did for this one is they took what's called the state fair market rent, which is just sort of an amalgamation or an approximation at a state rate. So for a family to afford a two-bedroom rental home in California, they need to be able to make $81,191 a year. The percent of extremely low-income renting households with severe cost burden, that means that they are paying more than 30% of their income for housing, is 76%. And in fact, the lower your income, the higher amount of your salary proportionately you're going to spend on housing. And sometimes, unfortunately, it's up to 60 or 70% of what you take home goes to housing. Next slide, please. And I have not been looking at the chat, so if, hopefully, Abel, if you could help me out with that. If there's any questions, let me know.
You're good right now.
You are awesome. Thank you. So the bottom line is that as of January 2020, which is when we last had a point-in-time study, which is where people go out and they actually take to the streets, literally, to assess what the percentage of homeless is in our state, California had an estimated 161,548 experiencing homeless on any given day. And homelessness, again, in this case means that they are living on the street or in a temporary shelter. 8,030 were families, 11,400 were veterans, 12,172 were unaccompanied young adults, and we classify that as 18 to 24. 51,785 were individuals experiencing what's called chronic homeless. And I'll tell you really quick what chronically homeless is. Chronically homeless means that they have a disability and have lived in a shelter, safe haven, or place not meant for human habitation for 12 continuous months, or 4 separate occasions in the last 3 years that total 12 months. In other words, these are people who have been living, quote unquote, on the street or in a temporary shelter, like, one of those mass shelters in Sacramento, sometimes during bad weather, Cal Expo, which is a fairground, they tent it up and they make it into a big shelter. So someone who's been living like that for 12 continuous months is considered chronically homeless. And we have about almost 52,000 people in California on any given day living like that. Next, please. So we're going to talk a little bit of the causes of unstable housing. There are a lot of different ways people can end up living unstably housed. And some of it can be things like, medical issues. Medical care prices are very high. A lot of people had good jobs, had a house, had a lot of things, and then because of medical costs, they lost a lot of things. And so that's one way. Mental health issues is another way. People who have either undiagnosed or untreated mental health issues sometimes end up living on the streets because family members may have kicked them out, or they have a very hard time staying within the rules of being housed, etc. Domestic violence or intimate partner violence, depending which term you want to use, is another big issue, particularly for females. That is actually one of the #1 reasons females end up homeless, is they have a history of domestic violence. Addiction issues, when we say things like that, I know that, people who use drugs or people who inject drugs is the preferred term, but I would also like to throw out there, although there isn't a lot of good literature on this, so this is more anecdotal than like scientifically proven, but there are a lot of different kinds of addictions, y'all. I mean, and gambling is a huge one. In California, people lose a lot of their life and money. Gambling. So I didn't want to limit it to just people who use drugs or alcohol. Poverty due to unforeseen circumstance, like I talked about, losing a job, separating from a partner, so now you went from 2 income to 1 income, that type of thing. You get hurt or you can't work, COVID hits, you lose your job, these type of things. Rent increases. We have one county here when I was working, that I worked with, San Joaquin County, who's amazing. And I got a call when I was working Hopla from them, and they were like, we don't know what to do. This is before COVID, because the rents of even some of our much more less desirable areas have gone up by $400 a month in the last 3 months, and our clients can't make rent. The reason we found out was because people, and this is no disrespect to any geographic area in California, nobody get upset, but the people from San Francisco area, the Bay Area, were moving to Sacramento because it was so much cheaper, right? Rent was cheaper. Well, that drove rents up in Sacramento. So then the people in Sacramento started moving to the Stockton area, which is in San Joaquin County, because it was so much cheaper, but all these areas were still within commuting distance, which raised the rents in Stockton. So sometimes things like that happen that can increase rents unexpectedly. Lack of affordable housing, we already talked about that. And then there's a certain percentage of the population that is living in what we would consider homeless or unstably housed. And these are people who prefer to or are not ready to be stably housed. And I'm going to talk about that very briefly. We're going to go kind of into it later, but there are certain percentages of the population who do not like to be in 4 walls for whatever reason. And they are much more comfortable living in encampments with people that they feel are their friends, with people that they feel are their family, because perhaps their family rejected them, perhaps society that is more, if you'll pardon the term, mainstream has rejected them. And this is much more comfortable for them. I know several women who live down by the river, which seems dangerous to me, being a female. There are different types of issues you face living on the streets, obviously. And these 3 women that I know, they're wonderful. They really, that's their life, and they don't want to change it. They're like, I have freedom to do whatever I want here. Nobody is going to tell me what to do. They all 3 came from abusive marriages, And they were like, we're done. We get to do, I want to get up, I get up. I want to eat, I eat. Nobody can tell me what I need to do. So there is a certain population like that, and we need to respect that. The other thing is that there are people who maybe are not ready to be stably housed. And I want to be clear about this. The best example I can come up with, because there are a lot of other reasons that I didn't put up here, and one of which I should have, and I'm sorry about the oversight, is legal reasons why you can't be stably housed. People who have evictions on their record, multiple evictions, people who have criminal histories of certain types of crimes, they can't get approved for a lot of things like vouchers, et cetera, or even rental agreements, and so that is another problem. People who have a variety of comorbidities or have been living outside the bounds of a structured environment for a long time may not actually be ready to be stably housed. Doesn't mean they can't be. It just means that you have to kind of back it up a little bit and do some more baby steps, as I call it. And I'll give you a good example of that. We had one county who had some leftover money from their Ryan White Part B, and so they decided to try an experiment, and I use that term loosely. It wasn't a real experiment. It was just they wanted to see if this would help. They housed a whole bunch of people who were that were homeless by government standards, right? So they were living in a car or whatever. And they rented out all these hotel rooms. I mean, like, I'm talking a bunch of hotel rooms for 3 months. Because they said, okay, if we put people in these hotel rooms, they won't have to worry about the things they have to worry about on the street. And maybe we can get them, like, signed up for disability, or get them signed up for vouchers for housing, or get them transitional, like they'd have time to work on that stuff, the clients would, I mean. And the woman who did it is amazing, Megan Murphy. And Megan said, and what we found out at the end of that 3 months is some of our clients failed gloriously. And I love that term. She said it was wonderful. We had one client that got kicked out of the hotel for having 200 people in his room partying, and he told us that the reason that happened, he did not know how that happened. He went to the grocery store, came back, and it just happened. Oh, my goodness. You know, so she says, I knew he was not ready for stable housing. I knew he could not abide by a rental agreement. I knew that he would get kicked out of anything that I got him into. And those evictions that you get when you get kicked out go on your record, and then when he is ready maybe a year from now or 5 years from now to be stably housed, we won't be able to do it because he's got 7 evictions. So we decided to back his stuff up a little bit, and we decided to see, okay, so what can we move you towards? What are we working for here? And it takes longer, but she said it was the most valuable thing for her, and in her opinion, him, because they could have invested a lot of time and money in getting him a voucher only to have him lose it, and that would hurt him in the long run. So that's the best example I can come up with. There were some people, by the way, who had problems the first month. They felt very disorganized because they never had a situation for a very long time where they didn't have to worry about, like, where am I going to shower, where am I going to get food, where do I put my clothes, where's my stuff safe, blah, blah, blah. But after the first month, they settled down, and there was a certain percentage of them that got signed up for disability. One of them actually went out and got a job. They got signed up for housing vouchers. And so those were the people that she knew, being a houser, as we call it. She said, these are the people I knew. Okay, now we're ready to move on. So hopefully that kind of made sense. I'm going to pause for a minute.
Jessica, we have a question from
Oh.
Go for it.
The question from Stacy: Are any of the chronically homeless also veterans, or young adults, or families, or are those numbers mutually exclusive?
I hear what you're saying. Okay, to be honest, let me look back. That one came from, I don't think they're mutually exclusive. I think some of them do overlap. Families are very rarely considered chronically homeless because of children being involved. There are certain laws that allow, I mean, it can happen, don't get me wrong. But in terms of young people and stuff, there could be some overlap between those numbers. You are correct.
And second question, how long do evictions stay on one's record?
Oh, that's a good question in California. So there's a lot of different ways to look at that. I am not sure currently what it is. I know at one point I believed it was either 5 or 7 years, but that may be different now. There are ways that with legal help you can get evictions expunged. And it's not a legal presentation, but one of the things that I really, if this was more of a housing presentation, if you all housers out there and you wanted to know what to do about housers, you know, about getting people permanently housed, legal help is the one thing that we highly recommend, looking at expunging some of those evictions, or if an eviction is in play, staving off that eviction. As you'll see a little later in the presentation, when we walk y'all through on how to get a housing voucher and you see how complex it is, you'll see why that can come up. But I can look up the answer and get it back to you for sure.
Can I do a follow-up to that then? You just mentioned legal help for housing. How readily available is that?
Yeah, so it kind of depends, to be honest with you. There are housing authorities will give you legal help, and I'm speaking broadly because it's different from county to county, right? Like there's no hard and fast rules, so I'm going to give you the broad answer. Housing authorities will give you legal help for fair housing issues, like if you're discriminated against or, you know, something like that. In terms of expungement and stuff, sometimes through nonprofit agencies, like I know California, Northern California Legal Services does some of that. UC Davis, no, I'm sorry, is it UC Davis? No, it's McGeorge School of Law. Their law students have a clinic that will do some of that. Churla, California, oh boy, I hate it because I use these acronyms and then I can't remember what they stand for. Rural Legal Association, I believe, they do some of that. But usually it's nonprofits and such. Our Housing Plus program that we fund through Ryan White, which is only in 3 counties, we actually, it was one of the criteria for applying for those funds that you either supply legal help or that you have an MOU with an agency that can give you legal help to be able to go in and do this kind of stuff. Unfortunately, there aren't a lot of places, but usually they're nonprofits.
Thank you.
No problem. So next we're going to move into sort of a profile. Next slide, please, of a person who is homeless. I really want to stress that there is no one profile. Like we know this, right? Like I know I'm, what is that expression? Preaching to the choir. I mean, you know, but I do want to stress that this is a profile situation from a very well done article, which I've listed at the end. So this client profile is, and the photo was from Jason Windsor, took the photos for these next few slides. And this is a photo of Dana and Lupe trying to stay warm by a fire on January morning, and I believe this is in Santa Rosa County. I mean Sonoma County, God, Santa Rosa, but Sonoma County. Next slide, please. So we're going to talk a little bit about Dana's story. Dana has been living in this encampment for 6 months. Before coming to the encampment, she was living in an RV. She was a victim of domestic violence. The RV was, quote, her words, a real good one too, because I paid $1,100 a month for it. The RV was her lifeline to escaping that situation. She says, but because of the debilitation of the RV, the police took it. Quote, I couldn't even get my stuff out of it and all my stuff was gone. And this isn't uncommon in some areas where the police will seize a structure or a tent and you don't have time to get your stuff, which can be really difficult if we're talking about HIV or some other STD or tuberculosis or Hep C or whatever, where the medication needs to be taken on a pretty daily basis. She didn't know anyone when she made her way to the encampment, but soon she became friends with Lupe, Lucia, and, quote, Jaguar, unquote. She says, we feel like family. Everyone who is here has their own story. And that is the thing that I was alluding to earlier when I talked about sort of this familial, why we don't want to say homeless. For her, this is probably a safer and more secure home than what she had when she was living in her domestic violence situation. Next slide, please. Christopher's story, and this is from the same encampment. Christopher is 33. He moved to Sonoma from Oakland. He was homeless also in Oakland. He's lived in the encampment in his truck with his dog Butters for about 6 months. He lists his trade skills as carpenter, electrician, mechanic, you name it, he can do it. But he can't really find a job, and it's really hard to hold down a job when you're covered in constant dirt and you don't have clean clothes. Who's going to hire you? And he had a really poignant quote, I thought, but there's a stigma when you're homeless. It's so different up here. He means up here in Sonoma versus Oakland. Down in Oakland, the police, they deal with actual gangs, you know, and big crime. But up here, they don't got none of that. So the homeless are public enemy number one, and that's the only people they have to deal with. So the article is about how the police go through the encampments and break them up and seize all their stuff and throw it out, and people have nothing left and have to go to another area and start over again. Next slide, please. So let's talk a little bit about what it looks like to live in an encampment. These encampments that were in this article, they call themselves self-maintained. And you can see the quote up there, we take care of one another, we have to. And that means that there are rules that are socially imposed by the residents. They sort of police themselves. Patrolling for individuals who are stealing from others. Theft is a huge thing in encampments. And when other problems arise, especially, so that's sort of what self-maintained is. They have their own communal, sort of informal system to deal with people who are breaking the rules. There are other problems that can arise, though, problems with hygiene and cleanliness, especially when rains come in. In this article, Dana said people get sick and clean water is a scarcity, and when the October rains came in, everything was worse, and that's moving into the rain and adverse weather conditions. As Christopher put it, it was like a derby in the mud here. Everybody got stuck, and all you heard was revving of cars for hours. Some of the encampment's disabled community members couldn't get out, and their nearby neighbors came with winches and plywood to help free them and to help free the vehicles. But not many were freed, and bumpers fell off, and tires ended up falling off and sunk into the terrain. Dana's car was destroyed by this mud situation, and she had to quit the one job she had. It was destroyed, she said. I had to quit my job because I couldn't get anywhere. I used to be a chef. I'm a really great cook. I can make any Mexican dish you can think of, but I had to stop because I didn't have a car anymore. And there were other issues with people with wheelchairs literally being stuck in these muddy lots where the encampments were. I'll stop there for a minute.
Jessica, we don't have any questions, but I am curious about the encampments. And you mentioned people working. Is there data around the numbers of those who are employed in encampments? And tagged on to that, I'm just incredibly curious about the conditions, or what are the conditions that bring about an encampment, and sort of the longevity of it. Because in Oakland, we've had some that had been there, and then all of a sudden they get dismantled by police. And I'm not sure exactly what the relationship is. It seemed most people, it was working fine from my perspective, or from people I know's perspective, and then the police just come in and tear it apart.
Yeah, there are so many different reasons. We face the same thing in Midtown. We go through waves, I think, in Midtown, where we'll have homeless encampments, et cetera. So in terms of people who work, who live in encampments, I don't know of any studies that have really well been done. I do know that a lot of times it kind of depends on what you mean by work. Some of the work is not, it's under the table type work, if that makes sense. Sometimes it's, people who work in the sex industry, different other types of things like that. So I classify those things as work, although it's not something you put on your taxes, that's for sure. So, that's why it's kind of hard to really tell. And a lot of times people are working under different names for a variety of reasons, and that type of thing. So I don't know of any good studies, but I can definitely go look for some. I do know of not a lot, what does that even mean? I do know of quite a few people that, anecdotally, that I've known over the years who live in their cars, who work either part-time or something like that, because they can only work when kids are in school. Daycare, childcare is a huge issue, and I think we all know that that's a whole different ball of wax or worms or whatever that expression is. And in terms of these encampments being broken down and what their longevity is, it's really interesting. I will be honest, from what I have read, and again, this is pertaining to California, I can't generalize it anywhere else. But from what I've read, a lot of it depends on a couple things. One, politics. When the encampments become too big and too much waste, et cetera, is being generated and it's hurting local businesses. And I want to do a little disclaimer again here. This is a no-fault zone. Like, I'm not saying darn those businesses, or whatever, because anybody, if someone invests their whole life savings and everything into a business, they have a right to have their business open and they need to make money at it. At the same time, in California, it's very interesting because we're a sanctuary state, meaning that if they are on public property, if someone is homeless on public property with a tent or whatever, you really can't kick them out per se. If they're on your property, in your driveway or in the parking lot of your business, then you can. So we're different than other states in that way. And a lot of it also has to do with safety. If public safety deems that the camp has gotten to a point where it is no longer safe for the residents or the surrounding community, then they will go in and break it up. We have had some problems in Sacramento, and I'm talking about Sacramento because that's where I live, where, there's been a couple businesses that went down in fires that were caused by cooking and such, because it has a large homeless encampment near it. Again, I want to be really clear. I'm not quote unquote blaming homeless people for that. What I'm saying is that it became a public concern in terms of health and safety. So I think this guy's comment is the guy that Christopher just profiled is very interesting. Carl's me and Abel's boss, Carl Halfman. Some of you out there may know him. Carl and I were like, wow, I never thought of that, right? The difference between Sonoma and Oakland. If you have a police force that is constantly, and I'm not saying Oakland is a bad place to live, but let's say something different. Let's say Los Angeles, where it's really big, it's really urban, there's some high crime going on, and there's some high violence stuff that's like 911 now, right? Compared to an area where you don't have that. I can see where his perspective may actually be correct, that perhaps police have more quote-unquote time to go in there and clean this stuff out. Plus, Sonoma County has a very high tourist population, and I think that has a lot to do with it, right? I know in Midtown, the Midtown Business Coalition was having a hard time because they're like, hey, during our tourist peak seasons, we can't have a bunch of encampments around all our restaurants and businesses because people won't want to come there. So I think those are sort of the factors that play. And that's COVID aside. COVID is a whole nother ball that was thrown into there in terms of communal living and the virus as we've been going through the pandemic. And I'm sure that Abel can address that later. But I'm talking just more in generalities outside of the, the pandemic. All right. Next slide, please. So now we're going to walk you through the happy, happy times of trying to get a housing choice voucher. When I speak to people or speak with people who are not aware, and when I say people, I mean myself, because when I first started with Office of AIDS, I had zero housing experience, Zero. Like, I told them not to hire me because I didn't know how my own mortgage worked. Like, that kind of no housing experience. Unfortunately, there was nobody else who wanted the job, so I got hired. But it's kind of been my career motif, actually. Yeah, nobody else wants that job. We'll hire you. But I was very perplexed as to, well, we have these housing choice vouchers. They're also known as Section 8. Sometimes people recognize that name better. And I was like, okay, well, we have these Section 8 vouchers. What the heck, people? Like, why is nobody being housed? And I can understand that misconception. And so Abel and I thought we would walk you through what it's like to get a housing choice voucher. So first, you have to wait, and you have to check and see if the waiting list is open in your county. And usually you start this process with some form of case manager, whether it's a housing case manager, or with a lot of our clients, it's going to be a non-medical case manager, because they may be seeing a non-medical case manager or a HOPWA provider, right, if they have HIV. So you're going to see if the waiting list is open in your county, because not all counties have open waiting lists. If it's not open, you can't apply. End of story. Do not collect $200. Next, if it is open, you're going to pick up an application, or if you have the ability to, fill it out online. Remember, not everybody has a computer, right? You will also have to provide documents for not just you, but for all of your family members, and those documents have to verify your name, date of birth, social security number, government ID, gross income, pay stubs, awards, letters of benefits if you're receiving social security benefits, printouts of benefits from disability, government ID got in there twice, and proof of citizen legal status. To get a Section 8 voucher, you have to be a documented citizen. So if you are not, you stop there. Now, if you're thinking about someone who's had to move a lot, or someone who has comorbidities, or someone who's on the streets, just locating those documents could take a year. I mean, no lie, right? It took me a year to get a copy of my Social Security card, and that was just one little document. If you are able to get all that together, then you go on a waiting list. The waiting list can be either months or years. To give you an idea, the average waiting time for public housing vouchers in the
Apply
state.
for a job for you at the state.
Sorry?
They sent you the
Oops, we're going to mute people. There we go.
Oh, okay, sorry. So the average waiting time in California is 3 to 4 years. Although there are some counties that I've seen where it's up to 7 years. So now you're waiting your 3 or 4 years, and by the way, the application can later on be rejected due to high demand or lack of funding, and then you would have to start all over again. So you could be on the waiting list for 2 or 3 years, and you think, yeah, I'm just about to get up to the part of the waiting list where I get a voucher, and they could either find something wrong with your application, or they could say we have such a high demand that you're now bumped down on the list, or bumped off of the list, and now you get to start all over again. Next slide, please. So now let's pretend you've gone through all that, and now you have a voucher available. Yay, easy street, right? Nope. So the housing authority will call you, and you will go in for a meeting that will review your application, because remember, it's probably been years, right? To make sure that everything is still as you had filled out, and you've all your paperwork that we've already talked about in, and there's no new paperwork, and you watch a video, you have an orientation. It's usually about a 2-hour meeting. Again, please remember, if you are living in an encampment, living on the street, living in some sort of shelter, living on, your brother's couch, whatever, this is a lot of time for you to take off. And if you do have a job of some kind, you have to take that time off of work to go do all this, even though you may be working hourly and you have to somehow explain all this to your employer. Step 6, once you have a voucher, you have 60 days. That's 2 months to find a unit. A unit is like an apartment or whatever. In addition, the unit must meet fair market rent standards, and it also has to pass a housing inspection. So what that means is that fair market rent is a standard that is, I referenced earlier, that's set in each county. So like, let's say fair market rent for your county for a 1-bedroom is $1,300, and you find a 1-bedroom. You have your housing voucher, but that landlord wants $1,500, you cannot rent it even if he's willing to accept your voucher because it's not within fair market rent standards. Let's say you find that $1,100 apartment and you're like super excited and you've got your voucher and the landlord will accept your voucher, but if it can't pass a housing inspection every year, then you cannot move into that place. And there's reasons for that, right? Because we don't want the government funding places that are really a hazard for the person living there. Note, though, that when that client has a voucher, and this is what I think most people don't know, when the client has a voucher, they have to pass an application process just like I would or you would. So they have to pass a credit checks, rental histories, evictions, et cetera. And even if they have a voucher, even if the landlord rents to voucher people, if that landlord does not feel that that client has a good rental history or credit checks, et cetera, they won't rent to them. And I don't think I need to go into here how very common it is that people who have had problems getting housing and people who are low income and people who have been in different disadvantaged situations probably don't have the stellar credit and rental histories. And what's interesting is a lot of people during COVID, I read this on one of the articles, and one of our, we got this information, by the way, from two of our housing providers with the HOPWA program. I emailed them and said, hey, can you walk me through this? And one of the providers said she was having issues because during COVID, a lot of people either chose not to pay rent or didn't pay rent. And landlords don't want to rent to anyone that does not have the credit score and the renter's history because they're worried they're going to lose their money. And then if people did not pay rent during those times, even though it was covered sort of during the COVID acts that we all saw, the CARES acts that came through, so they weren't evicted or whatever, it still goes on their rental record as not having been paid. Next slide, please. So, as you can see, it is not a walk in the park, that's for sure, right? So one of the things that we wanted to throw out there real quick, and we won't spend a lot of time on it, is something called set-aside vouchers. In the last two housing presentations I did for other groups, this came up, so I threw a slide in here about it. And there you see we're thanking Kathy Lee from Community Impact Central Valley in Modesto and Mary Rose Morales from San Joaquin Public Health, who is like the expert goddess of housing. So some counties have something called set-aside vouchers, and set-aside vouchers are exactly what it says. These are HCV, housing choice vouchers set aside for groups of people with certain conditions, HIV being one of them, because of the public health issue in terms of the link between housing and viral suppression, There are other types of set-aside vouchers. So each housing authority has the power to set aside vouchers. They're usually set aside for people, there's a certain percent set aside for people who qualify as chronically homeless that we just described. But anybody, any advocacy group, can go to their public housing authority, right? And they can ask and lobby for set-aside vouchers. So if you live in a county where you don't have set-aside vouchers for people living with HIV, you absolutely can go and lobby for those. A lot of activist groups, advocacy groups do. But even when you have set-aside vouchers, and that just means those vouchers sort of bypass the list. That's a bad way to put it. I don't like saying it that way, but it's the most concise way to put it, right? You still may not have a unit. And we had that happen in San Joaquin County. We had our Housing Plus program, pilot project, where Mary Rose followed a group of her clients for 2 years. We gave them rental subsidies, and they worked on getting permanent housing for them at the end of that 2 years, And Mary Rose didn't have any housing to give them because there were no vouchers. So she and some other groups that dealt with homelessness in her area, they went to the housing authority, and Mary Rose said, I have 13 clients that are graduating from this program, the Housing Plus program. I've worked with them for 2 years. I have housing plans to back up what I did with them for 2 years. They're excellent tenants. They have lived in these apartments for 2 years, and now their subsidy is going, and I need vouchers for them. I will continue to follow them through case management. You will not ask for a better, more successful candidate than these 13 people, and I need you to give me 13 set-aside vouchers. And I wish you could see Mary Rose. I think she's all of 4'10", just a really small voice like this. I can't even do it right. She's this real small place. But my gosh, that woman is a powerhouse. And by the time she got done talking, the housing authority said, how would you like 26 vouchers? They gave her double what she asked for. They called me that day. I'm not going to lie. That was the day I picked up the phone. They said, we have something to tell you. It's so important. We called you even though we know you're not working right now. And I said, what is it? Did you win the lotto? And they said, kind of. And they told me what happened. Man, I had to stop because I was tearing up so bad. It was incredible. That was probably like one of the highlights of my career here at OA, no lie. Unfortunately, out of those 26 vouchers, only 3 clients obtained housing. They could not pass the rental and the credit checks. And there was also an issue where they couldn't find people who wanted to rent to a Section 8 voucher because what did I say about San Joaquin County at the beginning of our presentation? Rents had been jacked up because of the influx of people from the Sacramento area moving in. Why would I accept a voucher when I could pay, get twice the pay for that apartment and have less risk because I can get all the security deposits and stuff? But I do want to say 3 is better than 0. I mean, I know that that doesn't sound like it right now. Later on, I think Abel's going to talk a little bit about take your wins. I still take that one as a win for Mary Rose and her team. I really do. And it took a lot of fighting. I just really, really want to put that out there.
Jessica, we have another question from Stacy.
Yeah, let's do questions because then I'm going to turn it over to Abel. He's going to talk to you about the real stuff.
So
Go,
Stacy
Abel.
is asking, when does the housing inspection happen? After one finds a place, or is this a standard practice of landlords to do each year?
Got it. So yes, the housing inspection is actually done by the housing authority. So a housing quality standards, HQS it's called, once the person with their voucher finds an apartment or a house, then the housing authority has to come in and inspect. It's this huge long checklist, and it has to pass inspection every year. Was there another question? Sorry.
Someone commented, this process seems so inefficient. There needs to be better alternatives.
Yeah, I think there isn't a single person, I'm going to speak for the state of California. No, this is just my opinion and not necessarily that of the state of California for which I am employed. I don't think there's anybody who would disagree with you, including people who work in housing. Honestly, it is the biggest conundrum you have ever seen. I think that one of the issues really has to do with building housing. We are the toughest state to produce low-income housing in for a big variety of reasons, which we don't have time to go into. Yeah, it is very inefficient. Again, please keep in mind, those of you who have worked with people who are homeless as, DIS or case managers, imagine that person having to run this maze, right? It would be almost impossible for me to pull off. And I have so much privilege. Like, I have a really good income. I have leisure time. I do not have small children. I have 2 graduate degrees. I'm not sure I could figure this out. So really, once we really have to keep that in mind, is that even though we're looking at this going, wow, what the heck, just imagine what one of our clients would have to look at this like and how difficult it would be for them to try to get their birth certificate, to get the Social Security or disability cards from 50 years ago when they, may have some other comorbidities that they can't even remember where they were. Other questions? Sorry.
That's
I
it.
get really into it. My bad.
Go ahead. That was
Got it?
Yes, go ahead.
All right. I'm going to turn the rest of the presentation over to Abel Martinez, who is DIS expert.
I wouldn't say expert, just some experience. Thank you. Next slide, please. Good afternoon, everybody. This portion of the presentation focuses on anecdotal experiences and recommendations for working with unstably housed people from a DIS perspective. So for those of you that sort of marked that other territory, hopefully we can find some crosswalks or some pieces that you can take from this. But most of this section could be considered preaching to the choir, like Jessica had mentioned. But we felt it was important to highlight some key aspects for disease intervention specialists. So as a DIS, I'm just going to go ahead and jump in. It's always important to remember our key objective, which is preventing disease transmission. A DIS core functions are to prevent future infections, ensure that a patient manages their infection, whether that be through testing, treatment, or referral services. A DIS must identify and locate individuals exposed to STIs and often wear multiple hats doing multiple functions, providing counseling and referral services to provide more of a holistic approach to their clients' needs. The work of a DIS is already challenging, and when we add the intersectionality of having a patient that is unstably housed, that can present an extra layer of challenges that a DIS needs to really learn how to navigate in and move through. Next slide, please. So some of the challenges that a DIS can experience working with unstably housed people can include communication with the patient. Oftentimes, unstably housed people experience challenges of having traditional communications. So lack of access to cell phones, internet can be a huge barrier to traditional DIS outreach. Constant mobility of the patient can also become challenging, especially if that patient is couch surfing or staying at various shelters or residing at a specific encampment. When we look at more of the dynamics, a patient's hierarchy of needs will always take precedent over our own goals, right, as a DIS. And so trying to understand what is most important to them can also provide insight on why they may not prioritize their health. Food, shelter, other priorities may just come first. So it's really important to really look at that from a broader perspective. Existing relationships and power dynamics can really influence a person's perception to work with you and trust you. And so government and medical mistrust are often ingrained in the thoughts of marginalized people. And so we really have to work extra hard on how we can sort of navigate that spaces and build that trust. Finally, time plays such a huge factor in working with unstably housed people. Your outreach attempts have to be strategic, and your investigative skills will be key in identifying when's the best time to reach a person. Next slide, please. So to alleviate some of these challenges, it's pivotal to collaborate across the board, hence collaborate, collaborate, collaborate. Building relationships with various partnering agencies will maximize outcomes and enhance your efforts. Some examples include building rapport with staff at your local shelters or identifying which is the best way that they will allow you to contact the resident. If there's anything in specific to their protocols, making sure you align with that. And identifying with the agency's hours, identifying the agency's hours of operations, identifying maybe when they're serving lunch, maybe the flow of individuals as they're migrating in or migrating out, really getting a sense of how how that agency works. Another piece of coordination could be coordinating with your local jails. And really building up that communication if there's a specific person that you may be speaking with that may help you locate individuals that are coming inside and outside of the jails. If by chance the local jail has some sort of internet database that allows you to locate new inmates, utilize what's readily available to you, because that can be super helpful in locating patients, especially if it's easy access to the public. Communicating with your neighboring jurisdictions will also be a huge help, especially if you find that your patient tends to frequent other jurisdictions. Especially if you're doing some investigation in the field, if you find that maybe your patient has another incident or another case that was worked from another jurisdiction, requesting that information, working with them so that maybe you could identify how they worked with that individual and incorporate that into your investigative techniques to see what worked best for them. When investigating in the field, you want to identify key gatekeepers, such as leaders of an encampment or other unstably housed people that may be familiar with your patient. You can always ask for information about your patients, right? But I just want to give a friendly reminder to keep their confidentiality a priority. So not to disclose too much information, but you can always just make conversations with people that are in the encampments and, ask a question. Have you heard of Sally, or do you know where she's at? Or, with public health, we have a lot of different scopes that we can utilize and not having to disclose specifically why we are there. You can always establish, actually I want to focus on establishing shortcuts and coordinating with your linkage to care, PrEP and patient navigators, or your local harm reduction programs to try and expedite services for your patients. Have social workers and benefits counselors on hand when you need to get them connected to services in a shorter time frame. I like to just think of it as like having them in your back pocket. If you have connections to any of your social workers or benefits counselors, creating some sort of backdoor mechanism to be able to expedite your patients to see these individuals can really steadfast the process and also build that trust that you're trying to do while you're coordinating with your patients. Next slide, please. And so recommendations to enhance your intervention services include getting to know your local unstably housed populations, such as identifying all the local shelters, perhaps any of the encampments in your county or your area, and any of the congregational areas that to best locate possible patients or your patient that you're doing investigative work for. If your agency provides incentives, utilize those resources to help build that trust. Hygiene products, water are necessities that unstably housed people can utilize, and by you providing any of those incentives can really go a long way, again, with building that trust. When conducting your investigation, be flexible and try various outreach times. Start early in the morning, or maybe try texting or staggering your calls throughout the day, or maybe even trying later at night before you're leaving the office or anything like that, or extending some of your hours so that you can try various mechanisms to try and get in contact with them. Utilize all of your partnerships and just be as resourceful as you possibly can. We want to be aware specifically of your own safety as well. And so keep that in mind, so that if you are going to an encampment or you're entering a dwelling, identify your exits before leaving or entering, because you want to be able to get out of a situation if by any chance you just need to leave for any reason. We want to be an advocate for your patients and do your best so that you can connect them to the services that they need. We want to really focus on building the trust and being consistent, especially with your patients. If you say you're going to give them a call in a specific time, or if you're going to meet them at a specific place, do your best to honor your word, because really that's all you have to build that trust in order to get them to the services that they may need. I want to encourage and recommend all of y'all to be patient, because sometimes your client won't be receptive to you. But that's okay. And it may take time to build that trust over time. And so most importantly, I did want to capitalize that, especially because we don't get this too often as a DIS, is that when you are successful, take the time to really celebrate those wins. If you were able to get an unstably housed person connected to care, or even connect them to a voucher, take a moment, because that's a really big moment, because as a DIS, I think we can share that not all of us get those wins as often as we would like. So definitely take that time to pat yourself on the back and acknowledge what the work that you have done. But at the same time, we want to know our limitations and understand your capabilities as a DIS. If you're unable to reach or find a patient after extensive investigation, really, focus on the wins and maybe don't dwell on it as a loss, because Maybe that person, like Jessica had said earlier, is just not ready at that point in time. And so that person may come back to you in a month, maybe in a few months, when they're ready. And so that's one of the key factors in working and coordinating with unstably housed people. In conclusion, I just want to emphasize the importance of meeting people where they're at. And what we mean by that is that human beings are just complex and dynamic. And it's really up to us to use empathy and communication to assist people when they're ready to receive the services that we're providing for them. Next slide. And last but not least, I just want to thank each and every one of you for the hard work and dedication that you provide to your counties and to the public health. I know it's not an easy job, and you are all on the front lines providing those direct services to the people of California. And I did see those other people in Washington and other states. So for those of you providing this public service, I just want to extend a thank you to you all. Jessica, did you want to add anything to that?
Yeah, thank you, Abel. You did such a good job. I have not been a DIS worker, but as I mentioned, I worked with victims of violent crime for a long time, where we would have to go out and find people. And I just want to also thank you for the hard work that you do. And I want to be very respectful that, you know, I think if you're new to this career field or relatively new, again, it can be very intimidating. And I know that when I was new, you know, working with people who are homeless or who are unstably housed was intimidating, because it really is its own culture. We tend to think of it as, oh, they're living in a shelter, you know, as if that's outside of their life and their community, because that is their community. And it is always uncomfortable walking into a culture of which you are not a part of. And I think it's important that we remember that we are not part of their culture. And so we shouldn't assume that we are part of it, or that we are, quote, just like them, unquote, because we're not, in a lot of ways, in terms of privilege, in terms of what we have. But I want to be really clear that the one thing, you know, people get all caught up on, what if I say the wrong thing? What if I do the wrong thing? What if I get frustrated? What if they can tell I'm uncomfortable? If you go in to any environment, but in this case we're talking about homeless encampment shelters, etc. If you go in with an honest respect for the human being that you are talking to, and you go in it with the only goal of making that human being's life better, even if it's only by a fraction, then there really is nothing you will do that will be so horribly wrong. And I really want to say that, because I know that we get so caught up in what if I do the wrong thing that it makes the anxiety so much worse. And I have probably made every mistake in the field known to humankind. I have made mistakes that other people have not even heard of, thinking that that was even possible to make a mistake like that. But if you go in there as one human being to another, wanting to enhance the life of that human being you're looking at, you'll be fine. And when you celebrate your wins, remember, your win could be something as simple as, this time that client answered the phone when I called. That may be as far as you get with that client, but you know what? That's a win. Thank you. And then if we have time for questions, we are more than happy to entertain them until 2:30 when we're done, if that's okay with Linda and Greg.
It's great. I would encourage anyone, if you have a question, please, you can unmute and ask it or type it in the chat. This has just been an amazing presentation, and I'm really grateful. So I'll wait to see if anybody has any questions.
Oh, and could you do one more favor for me? I'm sorry. Could you advance 2 slides down where it has our contact information? Those are the references. If you want those, you can email me, or you could email Linda, I'm sure. But sorry, yeah.
And we can share some of these slides with folks as well. Oh, and somebody is asking, this is silly and maybe I didn't catch it, but what does DIS stand for?
It is not silly. I had to ask myself when I first started, Abel.
Yeah. Disease Intervention Specialist.
And that is the reminder for us with acronyms. So I appreciate that. question.
That term can also be interchanged with public health investigator. There's a slew of different names.
Communicable disease intervention, CDIs, PHNs, a lot of different acronyms. But I just take a moment because I'm not seeing any other questions come in. I just want to thank Jessica and Abel. This was so informative, and I just appreciate that we looked at frontline staff at the end. We got very broad general information from Jessica, which was fantastic. And Abel, as I typed in the chat, I think this goes beyond, your recommendations go beyond DIS, but all frontline staff. These are things that we can be considering and thinking about. And the information that led us to looking at how to work with them, Jessica, what you presented around the encampments, and really helping us understand the definitions and what chronically homeless means is so important. And I love that you said if you go in with this intention of just being helpful, you really have a hard time making the wrong approach to somebody. So this was great. Thank you both. Experts from the field, it's so helpful to have that in our toolboxes now. So more to come on this topic, I'm sure.
Thank you very much.
There are a lot of accolades for you both in here. People are, oh, there is a question. Are the vouchers good for any city or just where they're applied for?
That is a good question. So the vouchers are usually specific to a county. However, there's something called portable vouchers, which can actually move from one state to another. And the housing authority that issues the voucher would have to work with the other county or other place that the client would be going to with the voucher in order to make it portable. I'm not as familiar with that system as I am the others, but we have heard, we had one client from a different state port his voucher to here in California.
So we can get the slides out with your permission, Jessica and Abel, and have that information and at least the referrals, the resources, and your contact information. So I appreciate everyone for attending, your attention, questions. Really great presentation today. Thank you.
Thank you for having us.
Thank you for having us. Thank you, everybody.
All right. Bye, everyone.